Good morning, this is Sunny Lee Williams. We've got an exciting overall content for you this morning for webinar 2 of 8 for the Cultural Linguistic Competency series supported by the Division of Mental Health and Addiction. This morning, we will have a 3-part presentation. The first part, I will cover the overall Healthy People 2020 and Social Determinants of Health, focused on 5 place-based domains. We have a very exciting opportunity where Ayanna Johnson, the Public Health Advisor with the Healthy People 2020 team, has joined us to give us a preview on the Healthy People 2030 topics that will be announced coming up in March of 2020. All right, so to kick us off, I want to give everybody a framework on how these webinars came to be. In the state of Indiana, the Family Social Services Administration, the Division of Mental Health and Addiction, there is a Cultural Linguistic Competency and Health Disparities Committee that is very focused on the following vision and mission that's presented on the screen. The vision is persons of all cultures and ethnicities partnering with local and state systems to achieve equity in access, services, interventions, and outcomes in our systems. And that's specifically a mission facilitating cultural and linguistic competency strategies throughout Indiana state and local systems to improve outcomes for populations vulnerable to disparities and disproportionalities. So specifically to this vision and mission, DMHA has a specific focus on the cultural linguistic competency focus, which is the Cultural Competency Enhancement Project. So the Cultural Linguistic Competency Project has been in place since 1996 with a focus to provide training services and technical assistance for community mental health centers and addiction providers throughout Indiana. Training services are designed to improve organizational effectiveness and efficiency in providing culturally competent services. So of the 40 or so organizations that are represented today's call, attendees that have registered and have signed on, the majority of the audience is from the community of actual service providers providing treatment and other services to the community at large. So these webinars are intended to be both professional development and also technical assistance content support for those organizations, and specifically the employees and staff of those organizations. There will be 8 technical assistance webinars through the 2019 to the 2020 timeframe. On the technical assistance webinar side, we will have 8 technical assistance webinars total. The first one was provided by Dr. Dennis Rudnick and really gave us the framework of how to approach the technical assistance webinars for this year. And his presentation was Towards Cultural Humility, which is a focus on the mindset of how we should be approaching the discussion on cultural competency. If you have not had an opportunity to view that particular recording, the link for that recording will be sent out early next week, along with the recording for this webinar, Healthy People 2020 and the Social Determinants of Health. You should have received a save the date for webinar number 3, which is Institutional Racism in Healthcare, which will be conducted by Dr. Christopher King on Thursday, February 6th. A quick note on continuing education units. The Division of Mental Health and Addiction is providing certified education units for participation in both the live sessions and also in self-directed listening to the recordings and passing of the competency quiz. There is a difference between the 2 options. So today, for everyone that has attended live, you will receive 2 CEUs based upon your live attendance during the duration, the full 2-hour duration of the presentation, first hour, and the second hour, which is dialogue and discussion. And then once you receive the competency quiz, you will, if you pass 7 out of the 10 questions on the content, you'll then receive the 2 full CEUs. For those that will be listening to this remotely at another time and pass the competency quiz, there will only be 1 CEU. And the difference is truly due to the benefit of participating in the Q&A and small group discussion live, where that really is the opportunity to, from a technical assistance perspective, ask questions, hear from fellow constituents and service providers, and glean that interactive and collaborative effort. Right, so for Healthy People 2020, on the social determinants of health, we are going to be covering the 5 place-based domains this morning: economic stability, education, health and healthcare, neighborhood and built environment, and the social and community context. We chose to utilize this as the second webinar of the 8 because it really provides nice fundamentals of building out the other topics for a cultural competency. Earlier in the fall and winter of 2019, we had sent out a survey to close to about 1,000 folks across the state, asking for feedback on which of 40+ topics would be of most interest on the technical assistance webinars. And so the 8 final topic selections were generated from that survey. Cultural humility, social determinants of health are good fundamental baselines of understanding the framework of our discussions, and then we'll be jumping directly into a very specific topics like institutional racism in healthcare, intersectionality in health, and so forth. We will be sending out individual registration links about a month before each webinar registration. We've gotten some great feedback of the 3 that have been released for Save the Dates thus far. Our average has been about 1 day in those webinars filling up. So we will be expanding our technology capabilities to account for additional webinar participants. Right, let's go ahead and get started with Healthy People 2020. It is my great pleasure to participate as the presenter today. Sunny Lou Williams here. And my social determinants of health experience is specifically in the state of Indiana, has been on supporting the Indiana State Health Assessment and Health Improvement Plan, which is a publication by the Indiana State Department of Health, and had the distinct honor of serving as the State Health Assessment and Steering Committee in 2018, which resulted in the 2018 to 2021 Indiana SHA and SHIP plan, and primarily focused on social determinants of health. Among those, I've also had the opportunities to work on programming on reduction in maternal and infant mortality within the state of Indiana, passing through the telehealth legislation, community health worker legislation, and additional home visit interventions for workforces such as peer recovery specialists and peer recovery coaches, along with community health workers. And then, of course, the community paramedicine programs that started back in 2013, where Indiana is held as essentially a state model for public safety engagements for non-emergency response in the home on a national level. So I'm really excited to be able to present some of the social determinants of health context within the state of Indiana today with the great audience members that have joined, and also with Ayanna Johnson from the Healthy People 2020 team. I'd also like to make special mention of Brenda Graves-Kroom, who is the Health Equity Director at the Division of Mental Health and Addiction. She is facilitating a team of DMHA folks that are participating in the webinar today. So thanks, team, for joining, and Brenda, thanks very much for all your support on this program. All right, our session takeaways today are specific to understanding the social determinants of health framework in the Healthy People 2020 policy, where Healthy People as a framework. Each of our webinars will be very specific to addressing a policy and policy-based language where it exists. Why are we addressing Healthy People specifically? It's because of the importance and impact of a framework, the definitions and prioritization, and Healthy People as a collaborative effort. So tying in what everyone on the call is doing from an audience perspective, organizational perspective, with the state, and also with a national context. Then specifically, how? How will we utilize Healthy People 2020 in our learnings today from Ayanna and the future Healthy People 2030 frameworks? How will we actually effectively implement that and what are resources that we can leverage to account for healthy people's impact to our day-to-day. So again, for session takeaways, we'll be looking at healthy people as a framework, healthy people as a collaborative effort, and healthy people as a resource. So to start off with, in answering the question, what is Healthy People 2020? Healthy People 2020 is the federal government's prevention agenda for building a healthier nation. It is first and foremost a statement of national health objectives designed to identify the most significant preventable threats to health and to establish national goals to reduce these threats. It sounds like a very simplistic statement, but there are over 1,200 objectives that have been identified on a national level. Simplistically, the goals are to encourage collaborations across communities and sectors, empower individuals toward making informed health decisions, and measuring the impact of prevention activities. Those goals translate into 1,200 plus measurable objectives that specifically look at the health in a national context and interventions and case studies to impact getting the progress of those objectives towards identified targets. The history of Healthy People 2020 is that it was launched in December of 2010. We're focused on 10-year agendas for improving the nation's health. So think of Healthy People 2020 not only as a prevention agenda, but also as a strategic plan, a communication plan, and also specifically a scorecard in measuring where we are today versus where we want to go and how we attempt to do that. It is led by a federal interagency work group in collaboration with 50 plus organizations, including the US Department of Health and Human Services, federal agencies, public stakeholders, and overseen by an advisory committee. So an incredible amount of collaboration across all departments and all departments of federal agencies, and then also inclusive of state-based coordinators and stakeholders, which we'll discuss in a little bit. So a tremendous amount of collaboration. So what is Healthy People 2020 from an overall vision, mission, and overarching goals perspective? The vision is a society in which all people live long and healthy lives. The mission, striving to identify nationwide health improvement priorities, increase public awareness and understanding of the determinants of health, disease, and disability, and the opportunities for progress, measurable objectives and goals that are applicable at the national, state, and local levels, and then engaging multiple sectors to take actions to strengthen policies and improve practices that are driven by the best available evidence and knowledge. And then, of course, identifying critical research, evaluation, and data collection needs. When we combine all of those items within a mission, we're looking at a comprehensive agenda, strategy, operations, action, and implementation plan to really make sure that we're moving that vision forward. Overarching goals are listed here, where you can say attaining high quality, longer lives free of preventable disease, disability, injury, and premature death, achieving health equity, eliminating disparities, and improving the health of all groups. This second goal here is really specific to a tie-in and alignment to the Cultural Competency Project and ensuring that those specific areas are addressed, not only on the national context and aligning that with the content that's provided and case studies have been tried in other states, but really what it means applied to the customized environment of the state of Indiana, the different regions around the state, and the different organizational cultures and populations that we are serving. Specifically then, we then create social and physical environments that promote good health for all, and then promote quality of life, healthy development, and healthy behaviors across all life stages as the ongoing progressive outcomes. So Healthy People 2020 is a tremendous bold goal, and we account for that by a very clear, concise, aligned framework, and all of those objectives, areas of focus, and measurable outcomes across the course of a 10-year plan. As with each policy that we look at, We also want to discuss very specifically frameworks. And the reason why we discuss frameworks is policy is essentially the what are we attempting to do, whereas frameworks are the how do we attempt to do it. And then specifically the actions and implementations is where are we now in our status. So Healthy People 2020 in the context of a framework really looks at determinants, those being physical environment, health services, biology and genetics, individual behavior, and the social environment. For our purposes in today's discussion, we're going to be talking about specifically the social environment and the physical environment intersections with health services, because those are the pieces where the audience that is participating really have the greatest impact. And that's why we've assigned particular content focus on the 5 place-based domains in our interactions with clients and populations that we serve. The greatest impact, of course, is when we are able to address all the determinants at all levels. That is a comprehensive, from an organizational perspective, structure, resource, and overall policy and procedure support that would be able to address all of the above. So today we're going to be looking at simply the cross sections of the social, physical, and health services environment and how those 5 place-based domains impact our existing clientele. So what are some of those key challenges to addressing social determinants of health? If we say addressing all determinants equates to the greatest impact, what are the challenges to addressing all of them? Well, first and foremost, from a very specific day-to-day interaction, it is asking clarifying questions to our clients and populations that we serve beyond the treatment and intervention and focusing on an individual needs basis. That is difficult to account for given the resource, the time, the bandwidth, and the capacity of our organizations today, but it's vitally important to ensure that we do understand social determinants of health impact on treatment, on interventions, and on individuals' both competency and capacity to understand the health information and treatment information that's being provided. We also look at the diversity of needs. If we are a single individual facility-based provider, that is a significant amount of stress and strain on our staff to be able to account for all of the diversity of the entirety of the population that we're serving. If we're regional, if we're multi-state, the diversity of needs based upon the population that we're serving expands exponentially. So the diversity of needs needs to be assessed based upon those original survey and clarifying questions to say, can we address these particular individual needs on a more standardized basis? Do we have referral partners, referral management processes, policy and procedures to deal with this both equitably and also consistently? And that leads us to equitable, inclusive practices supporting each individual. What happens when our clientele and the population changes? What happens when we have new patients, clients, individuals that come in that have totally new needs? And how do we ensure that those needs are accounted for in equity, in designing of both language, both cultural competency, and of course, specifically to the individual's comfort level in having those practices being specifically identified for an individual and a group of persons. So addressing all of those determinants at each level, the individual, compounded to community, societal, and then organizational changes on process and procedure side that ultimately impact the environment that your organizations are supporting is really a multi-level, multi-layer policy and procedure approach when we look at social determinants of health. In later slides, we will be discussing specifically how we do that. So with those key 4 challenges when it comes to social determinants of health, where and how do we start? How do we actually begin addressing social determinants of health in complement to our treatment and intervention services, in complement to our community outreach and engagement, and also in complement to the specific non-medical, non-clinical services that we're offering to our clients and patients today. Well, the first starts with understanding the definitions of how the Healthy People 2020 framework has been built, accounting for definitions specific to the framework and also the policy and procedures and examples provided, because it's a wealth of resources of what other states and other organizations in your very same or similar positions have tried and been successful at in the past. And then understanding what those prioritizations are, because as I mentioned earlier, there's over 1,200 objectives. There's not a single organization that could approach all 1,200 objectives at once, nor could they effectively impact even a fraction of those objectives if they're not aligned specifically with the organization's priorities and the community health needs of the environment that that organization is serving. And then finally, we look at collaborative efforts. What's been tried? What's new and novel? What's a great case study? What's an evidence-based practice? Many times when we look in social determinants of health and in general, community overall health and outreach and engagement, it's a quote unquote new to me. Didn't know that this existed, didn't know that this was tried. Let's see what those particular policies and procedures are. Where do we have to customize, and how does that actually impact our specific population? So that collaborative effort of innovations, what is new out there, what are we able to see and learn from, case studies, who's tried what, how did it work, and how can we adapt it, and evidence-based practices, direct replication, models that work with outcomes that are significant, are part of the resource offerings of the Healthy People 2020, both the dashboard and also the website. So we'll talk about those as far as direct implications and application to how Healthy People 2020 and social determinants of health can be impacted from a technical assistance perspective within the state of Indiana and relevancy to the organizations that are on the call today. So I had a wonderful teaching moment that Ayanna supported me on, looking at all of the Healthy People 2020 framework. She gave me some great direction to say, hey, Sunny, when we look at this enormous amount of measurable defined outcomes, here's how we really break it down. So I really had to think through it, and I thought maybe a visual will help in really understanding the hierarchy when we look at Healthy People objectives and how all of this fantastic research, case studies, information, and details have been boiled down into a living framework, a progressive dashboard, and teaching resources and tools. So please forgive my poor illustrations, but this is how visually I looked at it to say, okay, great. I understand that the crux of it, there are 1,200 objectives. Amazing that we've even been able to identify 1,200 measurable objectives that impact being able to lead healthier lives. Well, 1,200 objectives is a lot of objectives. So those objectives are then really streamlined into 42 much more manageable topic areas. 42 still in and of itself, though, is a lot. It's a big number. So there were mentally essentially two ways that, as Ayanna was reviewing my content and giving me some feedback and advice, that essentially I looked at it from a ways to organize. There are, of those 42 topic areas with the max 1,200 objectives, we can organize those by high priority issues, which are then called leading health indicators. So that's a much more meaningful extract with 1,200 objectives become the top 26 collectively that should be focused on to support overall improvements in health, then socialized into 12 topic areas. Then specifically for the context of our audience today, I chose for the first part of the presentation to discuss it by place-based domains because we have organizations represented on the call that really are more focused on the domain side. So place-based services, both geographic, age-based, and also environmental and kind of contextual, rather than addressing all of the health indicators all at once. So I'm going to take a moment and depart from the PowerPoint by clicking on the leading health indicators. It will take us to a website, and that website is going to show you the actual leading health indicators by topic, just so you have that information and you have a visual. This is the overall leading health indicators dashboard. So you'll see the 26 objectives listed on the side: adolescent health, access to health services, cancer, diabetes, environmental health. Those are the key topic areas. And then specifically in a non-bold print, the actual measurement. So I'm going to scroll down further and pull some that are very specific to and relevant to the audience that is on the call today. So for example, mental health and mental disorders, looking at a target age adjusted for suicide reduction, where unfortunately the dashboard today is that at a mid-course value review, we're actually increasing across the nation. Mental health and mental disorders for adolescents with a major depressive episode in the past 12 months, again, increasing. For those that are working with maternal neonatal abstinence, there are some specific maternal, infant, and child health areas here. For those working on nutrition, I know we've got quite a few managed care entities on the line that are focused on diabetes and obesity as part of overall reduction in chronic disease management. These specifically are obesity among adults, among children and adolescents, mean daily intake of total vegetables, and then of course, for our opiate treatment providers, our substance abuse and other recovery treatment centers, the indicators for substance abuse, adolescents using alcohol or illicit drugs in the past 30 days, binge drinking, and then of course our tobacco focuses. So again, this overall is the top. If we focus on these areas, will significantly drive and impact the overall leading health indicators. You can sort them by objective, which will just do an alphabetical order sort, and you can also sort them by status. So we need to celebrate our wins, but typically I just go right to the bottom and say, what are our biggest issues? This is helpful because if you click, and let's go directly into the suicide piece, you can look at much more detailed information on baselines, targets, data, articles, and additional leading health information. So think of this as a very concise, very succinct resource guide for any of the specific topics and objectives that would be aligned with your treatment practices, priority outcomes and objectives, and overall strategies for your organization. Very, very smart, concise, aligned information, and not much searching. You've got all the information here for you. I can't promote more the opportunities that you can impact your organizations with by having all of this resource at the tip of your fingers. We're now going to go back to the PowerPoint and discuss a little bit more expansion-wise on the overall high priorities here. So from here, you'll see that Healthy People 2020, from a leading health indicator, there are 42 topics overall. So each year, or rather each decade, there have been additional leading health indicator topics that have been added. So 2010, going into 2020, resulted in 42 overall leading health indicator topics. Then those primary topic areas are these 12 listed here, from access to health services through to tobacco. As I advance the slide, you'll see that the Healthy People 2020 topics today, of those top 12 that we're focusing on the leading health indicators, we're going to be specifically focusing on the social determinants and organizing that and reviewing that from a domains perspective. In subsequent webinars, we will be discussing specifically mental health, but given that this is webinar 2 of 8, we need to make sure that we have a fundamental understanding of what Healthy People 2020 framework is, because this will be a repeated concept through our additional webinars, both from the perspective of using Healthy People 2020 as a framework, as a resource, and also as a collaborative effort in further explaining and impacting some of our other webinar topics. So today we'll be going to review social determinants, but we certainly will address mental health in subsequent webinars. So the definition, as we look at social determinants, determinants of health and health disparities, are specifically biological, social, economic, and environmental factors and their interrelationships, and how they influence the ability of both individuals and communities to make progress on those indicators. Addressing these key determinants then ultimately improve population health, eliminates health disparities, and meet the overarching goals of Healthy People 2020. In alignment with what our state's FSSA DMHA focus is on cultural competency, this eliminating health disparities is a key outcome of why we are looking at Healthy People 2020 as a framework, and also essentially directing and promoting our audience members to really look at the Healthy People dashboard and resources to see in your areas of expertise and in your specific populations that you are supporting, what have others done? What can we replicate or implement? And then ultimately, what can we contribute at a later date? The domains then are really broken out into economic stability, education, health and healthcare, neighborhood and built environment, and the social and community context. The following 5 slides will cover specifically what each of those 5 place domains are, their specific definitions, the objectives underneath social determinants of health, and the objectives overall tying into Healthy People 2020. I'm going to go ahead and advance the slide to the first one, which is economic stability. I'm not going to read through all of the objectives, but this first slide, I wanted to kind of give you a mapping, if you will, of social determinants domains and how to read essentially the information provided. So this is literally a screenshot extract from the Healthy People 2020 website, where we go into economic stability, which is one of 5 place domains. Again, how we approach and how we organize content is very important in being able to, one, how we communicate that messaging out to both our staff, our patients and clients, and our community in the services that we're providing. So as we go through social determinants of health on the domain side, keep some key questions in your mind of, does this domain actually apply to me? Am I working on any of the specific bullet pointed items under the definition of domain? If I am, there are resources for me and also objective measures for me to actually look at within Healthy People 2020. If I'm not working on those specific areas today, but I see interdependencies within my referral partner network, this is a great framework and resource tool to also share with your referral partners to ensure that they have the best access to resources and also to other ideation and measurements to support their particular areas of focus. So this first slide, our domain is economic stability. That domain is further defined as working on the reduction of poverty, increasing employment, identifying food insecurity first and foremost, and then alleviating food insecurity, identifying housing instability, in migration, out migration of populations dependent on both employment opportunities and also major impacts and changes within housing instability based upon zoning, build outs, fair housing, et cetera, et cetera. So those are the definitions of domains. Audience members that might be working on economic stability that are on the call today may be individuals that work with trustees' offices, managed care entities that look at housing and homelessness as part of impact to overall health. And then, of course, the agencies, both local and state, that focus specifically on these areas. The Indiana Housing Community Development Authority, multiple of our food banks, pantries, church organizations, interfaith organizations that focus on food insecurity, food deserts, and then, of course, bringing in our local employer partners when we talk about economic stability and understanding what are their upcoming hiring trends? Is there growth or is there concern in certain industries? And how does that impact the overall economic stability of the population that we're serving? Indiana is significantly focused on advanced manufacturing. So when there are new employers coming in, what does that do to the healthcare resource pool within those communities? When we have, unfortunately, organizations leaving, what does that do to the overall economic impact? So as we look at that, on the right-hand side of the page, there are specifically objectives defined as social determinants of health. So the first one, as an example, the proportion of children aged 0 to 17 years living with at least one parent employed year-round is a significant social determinants of health item simply because that is a familial impact towards how much income is available within that particular family unit. And with that income, how does that impact the ability to seek healthcare services, transportation, and all other impacts when it comes to childhood development, food and nutrition, and so forth from social determinants. As you go through these slides post our review today, you have more of an opportunity to look at each particular measure. My main goal was to help you to take a look at how it's organized within Healthy People Framework, how you can actually search by place-based domains, and then identify the areas of impact and relevancy to your particular organization. I'm going to move on from economic stability over to education. On the education side, education is a specific social determinants domains because education is a very place-based focus. But education is also a leading health indicator. So on the left-hand side of the page, the education areas of focus there with those particular social determinants of health and other objectives are listed to say, collectively, under Healthy People 2020, what are all of the different objectives tied under education? We need to be clear about those particular objectives because we have lots of folks that are part of the Cultural Competency Project that are specifically school-based, whether K through 12 or even our higher ed. We're looking at this as educational institutions to account for a lot of the training, not only for our students, but also for our faculty and staff, and also accounting for these measurements to be passed on into the core measurements, core objectives, core scorecarding of education specifically for the context of an academic institution, in addition to how it impacts social determinants from a increase of health and living standards perspective. So more simply said, our systems of care coordinators, our superintendents, our teachers should be well communicated on these particular areas by the audience that is on the call today to ensure that everybody across the board working in education has these measurements and understands where we're going from a baseline to targets to improvements overall. So the leading health indicator across all health objectives on the education side, i.e., if we were to improve this one specific objective, this would then significantly impact the overall increase in health and health improvement, is increasing the proportion of students who graduate with a regular diploma 4 years after starting 9th grade. Simply put, our high school graduation rates. That is a meaningful index and objective measure that our educational institutions look at. But now it's tied to specifically health indicators and the health outcomes of what happens when those net results are not met. So education defined as high school graduation, enrollment in higher education, language and literacy, and early childhood education and development all come across the social determinants domains. Examples, our managed care entities often participate in back to school events for health screening. So what if our managed care entities continued to provide education support throughout the year when it comes to other key topics on leading health indicators, social determinants of health? Well, we're talking about the bridge between systems of care coordinators and also the systems of care coordinators sharing information to our educational and academic institutions. What are other resources that can be pulled from the Healthy People 2020 dashboard and also objective measures to ensure that we're all on the same page when looking at objective measures and being able to give actual resource-based education guidelines from a health outcomes perspective in the conversations that we're having with our social determinants of health referral network partners. So some food for thought there. And again, if you click on each of these specific areas, you'll be directed specifically to those resources. Right? Then on the third social determinants domains, this is health and healthcare. So access to healthcare, access to primary care, and health literacy overall. Specifically in these areas, we want to account for 2 key points within the relevancy to the audience here today. And the first and foremost, and probably one of the most simplistic policy and procedure changes, is increasing the proportion of persons who report their healthcare providers always gave them easy to understand instructions about what to do to take care of their illness and health conditions. So specific implementation areas here are the provision of language and culturally competent and appropriate materials to our patients and clients. Another example is employing community health workers and other patient advocates that have the ability from a cultural background, experience, and language perspective to support those individuals in really understanding what does that mean when I'm at home undertaking these treatment instructions? What does that mean when I'm at the pharmacy picking up these prescriptions, et cetera? What does that mean when I take what's provided as instructions for my own health in concert with the broader interactions of my day-to-day life? Impact to nutrition, impact to exercise, impact to medication on my day-to-day, and so forth. And then also on the second item, not just providing the instructions, but coming back and following up and asking to describe how they will follow the instructions. So providing an understanding of, okay, yes, from the patient client side, yes, I heard you say this. For me, that specifically means I will do this. So that there is language utilized in a verbal communication of accountability from the patient and the client side. Too often, we simply provide instructions and simply say, do you understand? And it's a yes or no. No, a repeat back of that verbiage in the patient client's own words so that they can physically visualize and understand what that next step is and what their own accountability and actions are. When we look at the Healthy People 2020 targets from a leading health indicators perspective, we are looking at people with health insurance. So again, for our MCEs on the call, people with a usual primary care provider. So again, maximizing that care team environment and so forth. As we look at social determinants domains for neighborhood and built environment, we are looking at definitions of accessing to foods that support healthy eating patterns, quality of housing, crime and violence, environmental conditions, and so forth. So these areas are specific to really core environmental, but then also our partnership with public safety, reducing homicides, physical assaults, reducing children's exposure to violence. Today, these are all reactive targets and measurements. As we get into prevention, what are we doing in changing the culture of training, awareness, and education within, again, our place-based domains in our schools, in our public safety institutions, in our employer, and also our overall social services and provider context as well. Moving forward to the social and community context, this is about social cohesion, civic participation, discrimination, and incarceration. So as we look at these particular areas, it's expanding our overall referral partnership to look at our community-based criminal justice, our civic and additional areas of community involvement and support, the ability to have rich cultural heritage and understanding of legislation, et cetera, from a civic participation perspective. And then also understanding that there is an opportunity for dialogue. So specifically here, increasing the proportion of adolescents who have an adult in their lives with whom they can talk about serious problems. Increasing the proportion of adults with disabilities who report sufficient social and emotional support, and then the proportion of parents who use positive communication with their children. This is a incredibly impactful outcomes, or rather, excuse me, incredible impactful objectives when I looked at this, because it really draws to light a lot of the negative impacts of having technology and social media be a very individual-driven based interaction. So how do we increase this to more interactive, face-to-face, social and community context, reach out and understand somebody context for social determinants? This is a lot of the work that our community nonprofits, our non-clinical, non-medical providers are doing, a tremendous amount of prevention, awareness, and education, all to account for really the social dialogue and the impact of community on our overall community-based mental health. So these 5 place-based domains, summarized again here, is one of the ways that when we look at it from an organization's perspective, all the audience members on the call today, how do we impact that for how you will both address your own strategic plan organizationally, your priority areas of service, and then last but not least, the specific alignment with Healthy People 2020 so you can leverage and maximize those resources. This next slide, I won't read out to you in detail, but I just wanted to share with you a summary of the pieces that I discussed prior of how do you use Healthy People 2020. One as a dashboard where you can look at the status of leading health indicators. We looked at that through the mid-course review, the objective targets and where we're at. And then as a resource, we covered evidence-based practices and the tools and resources per each objective. But I also want to make sure that everyone's aware that there are policy levers available as resources there as well. So if you're an organization that is actively lobbying in the State House and you want to look at other legislation from other states or why legislation is important to public health progress, these are very specific resources that you can identify. Then, of course, we have a state coordinator, Ms. Lindsay Buza. I apologize, I did not contact her directly prior to this webinar series. So if you do decide to outreach to her, please kind of give her a little bit of context on how her information was shared, but she is the listed state coordinator for Healthy People 2020. And then of course, the program, from a program implementation guide perspective, there are specific program planning implementation guidelines through Healthy People's implementation framework called MAP-IT. So please take a look at that if you're looking at implementing any new programs along the five place-based domains that we identified today, or any other programming that are tied to Healthy People objectives. And then finally, the Indiana State Health Assessment Improvement Plan, there's a link to that there. It's a PDF downloadable document, and that is covering May of 2018 through December of 2021. So that's the state-aligned Healthy People 2020 objectives specific to our state. So I leave you with the impact to the whole person with a little bit of a teaser on what we'll be discussing in future webinars when it comes to mental health. These are the 3 key objectives as part of the core 26 main objectives of leading health indicators. The bottom 3, with little or no detectable change and or getting worse, all have to do along the lines of substance abuse, mental health, and mental health disorders. And that is the crux of why the Cultural Competency Project exists and why the technical assistance webinars have been identified as such and provided. Additional to that, these are the things that we're going to be working on together over the course of this year and next year, and identify what do our organizations need in order to reverse this negative trend. What policies and procedures, what technical assistance, what support on bringing the community together for focus groups, what support on identifying additional evidence-based practices, models of care, replications of standard processes, and or even just pilot innovation case studies that can get us there. So from there, we will be looking at additional surveys and assessments. For those that have returned the National Class Standards Survey on the organization side, that was sent out to about 30 organizations through the support of Brenda Grave-Crooms and Tony Toomer, the head of the opiate treatment provider groups. That's great information that we're surveying, getting feedback on what is needed within your organizations from a technical assistance support side when it comes to frameworks, policies, resources, technical assistance, and then meaningful implementable content. So I leave that for you on food for thought as we specifically dive into mental health in later webinars on the impact to the whole person from Healthy People 2020 specific to the leading health indicator, mental health. And it is my distinct pleasure to introduce Ms. Ayanna Johnson, the Public Health Advisor in the Office of Disease Prevention and Health Promotion at the U.S. Department of Health and Human Services. I'm absolutely thrilled and so thankful of Ayanna's time to participate in sharing with us a really exciting advanced preview of what the Healthy People 2030 opportunities will be coming out. Ms. Johnson manages at the ODPHP the Healthy People 2020 strategic partnerships with state health departments and other non-federal organizations. She leads the efforts across the country in regional meetings on healthy aging policy and practice, and she focuses on a variety of public health issues on working committees, specifically on health equity, women's health, and adolescent health. She does the external outreach by hosting listening sessions with public health professionals to inform the development of Healthy People 2030. And then prior to joining ODPHP, Ms. Johnson joined the Office of the U.S. Surgeon General as a Health Policy Fellow for the Division of Science and Policy. She has incredible experience from policy management, the National Consumers League, focusing on consumer health, health professional graduate training, and chronic disease management. She holds a Master of Science in Public Health from the Johns Hopkins University Bloomberg School of Public Health. It is my distinct pleasure and honor to introduce Ayanna Johnson to share with us her insights on Healthy People 2030. Thank you so much for joining us. Ayanna?
I'm excited to be here today and talk about Healthy People 2030 and where we're going for the next decade of this initiative and our plans for improving the nation's health. So I just wanted to give everyone a quick primer on who ODPHP is. And so that's ODPHP stands for the Office of Disease Prevention and Health Promotion. And we fulfill our mission really by guiding the nation toward better health through disease prevention policies and programs. We work on programs that set national goals and objectives for preventing disease, including the Healthy People Initiative, which you just heard about. We are currently in our 4th iteration and moving to the 5th. We also manage the National Clinical Care Commission, which is developing recommendations on federal programs related to diabetes, and we support 2 national action plans to improve health care quality. Our office is also the office that provides the nation's guidance on nutrition and physical activity. We develop in partnership with the USDA the Dietary Guidelines for America, and we also are the lead HHS agency working on the National Physical Activity Guidelines for Americans, and recently we launched the Move Your Way campaign, which was designed to encourage people of all ages, shapes, and sizes to get active in their health. And our office recently became the home of the President's Council on Sports, Fitness, and Nutrition to promote good health and nutrition through physical activity. We also have a few initiatives on health literacy, and you can find on healthfinder.gov a website that provides easy to understand health information and resources for consumers. So you've pretty much already heard all of this, but just to frame how we think of healthy people, we really see it as being used in many ways. It's a data tool for measuring program performance. It can be seen as a framework for program planning and development, a goal setting and agenda building platform. It's useful for comparing state and local data against our national benchmarks. And we like to really think of it as a national agenda for forging partnerships. And a fun tidbit, Healthy People has been used as a model for disease prevention and health promotion by a number of different countries. We have provided guidance to Egypt, Israel, Japan, Korea, Australia, China, Brazil, and Uruguay, to name a few. Next slide. And so now I'll quickly talk about Healthy People 2030 development. So on this slide here, you see our development timeline. So Healthy People, we began developing it for 2030 back in 2016, where we held the first meeting of our Secretary's Advisory Committee on National Health Promotion and Disease Prevention Objectives for 2030. And as Sunny mentioned, the Advisory Committee really provides guidance and information to HHS and the Secretary about where we should go for this initiative. And then we take their guidance and develop what we think makes sense internally within the federal government. Since then, we have developed and released our framework for Healthy People 2030 in 2018. We've also shared our proposed objectives, which were shared during public comment in January of 2019. And we proposed objectives based on public comment and based on what we heard back from stakeholders that are currently undergoing HHS departmental clearance. And we anticipate launching Healthy People 2030 in March of 2020. So we're really coming up on our launch of this next iteration. As part of the Healthy People development process, we've really involved stakeholder input and participation, in addition to providing guidance on their feedback during the public comment. The public was also asked to provide feedback on our framework as well. So what we believe that what we're putting out now is really based on input from a variety of stakeholders in different sectors. And so we're really proud and excited to share the next iteration with everyone. Healthy People 2030 I wanted to highlight some of our 5 key elements and how we're thinking of the initiative going forward. So in our next few slides, I'll sort of delve deeper into each of these topics, but just overarching, we've released an updated framework that really focuses on the social determinants of health and health equity and the importance of stakeholder buy-in and engagement. In 2030, we are actually releasing a more streamlined set of objectives with data that adhere to the strict data standards and are of national priority. This was based on feedback from stakeholders over the last couple of years that Healthy People 2030 we will be reducing by more than half from the number of objectives, so 1,200 in 2020 to around 400 in 2030. We hope that we are still having a balanced set and that it really represents the national health priorities and it's a lot more actionable. We also will have 3 new objective categories. We're calling these the core developmental and research, and I'll go more in depth with those. And we are excited to launch with a new website that has improved organization, and it's a bit more intuitive and helps mimic the structure and the reality of public health in this country. And we are excited to continue helping to forge partnerships and using communications tools to really get out the word about the new initiative. So again, we'll have a number of our resources, our evidence-based resources, our tools for program planning, but even some more. So on this next slide, you can see our Healthy People 2030 framework. So it's very similar to what we have in 2020, but in 2030, we're envisioning a society in which all people can achieve their full potential for health and well-being across the lifespan. Our framework, as I mentioned, was developed in the first phase of our development and was approved by the Secretary of HHS in 2018. The framework and our mission and overarching goals really help provide our guiding principles and plan of action as well. And you can find all of this and more on our website under the About section. However, I wanted to highlight a few key nuances with the 2030 overarching goals. And you'll see here, we are really hoping to attain healthy, thriving lives and well-being free of preventable diseases and disability. And we also are hoping to make sure we've expanded our social determinants of health definition to really explicitly call out the social, physical, and economic environments that promote attaining full health. And in the last overarching goal you can see here is that we really hope to engage key stakeholders and external leadership to really drive action and to design policies that improve health. So it's not just those of us in the health sector who have a responsibility. It's really looking at those across different sectors. So we're talking about transportation, housing, education, law enforcement, et cetera. So really modeling that role, the social determinants of health, in our overarching goals. So I wanted to take a quick second to explain how we made it from 1,200 objectives to about 350 objectives that went into departmental clearance. You'll see here the 5 or 6 major steps. So in early 2016, we did 2 assessments of our Healthy People objectives by our topic area work groups. So those 42 topic area work groups who are federal subject matter experts used a data assessment tool to identify their objectives that made sense. That led us to 411 objectives, which were then presented to our federal interagency work group. We then had another higher level review composed of representatives across the department who provided a more broad public health perspective. That narrowed it down to about 355. We then went through internal departmental clearance and FIW approval along with public comment, and we are in the process of departmental clearance. So we really went from 1,200 to 356, and we're really excited to share how we did that. So on our next slide, I'll show you what our assessment criteria, and we hope to be able to really publicly publish this in a more comprehensive way so that folks can maybe use that same model in identifying their own objectives. So we had an initial assessment criteria that said that the objective must be measurable, have measurable data by the cutoff for inclusion in Healthy People 2030, which was 2019. We also made sure that the baseline data was no older than 2015, and that we could guarantee that there would be an additional data point across the decade. 2 additional, actually. And then we had a second round assessment of selection criteria. So our second round, we made sure that the objectives were of national importance, that they had direct impact or influence on health, that they had a broad or comprehensive applicability to the broad swath of our population, that these objectives identified substantial burden, and that they were obviously national public health priorities. Our second selection criteria was looking at evidence-based. So, do these objectives have effective interventions to achieve them, and are they replicable? Can other people take them and use those interventions to support our nation's health? And then finally, we really looked at the importance of health equity and health disparities. So, are we identifying, if we achieve these objectives, are we helping to eliminate health disparities and improve equity in our nation? So we have 3 objective types in Healthy People 2030, and you see the 3 here. And this is a little different from what we have right now. So in Healthy People 2030, our first main objective will be called the core objectives. There are measurable objectives with reliable data. They have a direct impact or influence on health, and they really they fulfill those 5 criteria that I discussed earlier. We then have development, and these objectives are what you would see on Healthy People 2020 as the objectives that have data that are being measured, that are being updated regularly. Our next objectives will be the developmental objective, which is meant to fill in gaps identified in the core objectives. So developmental objectives represent high priority issues, but they probably don't have reliable baseline data at the time of us developing Healthy People 2030. But we do know that they have evidence-based interventions that have been identified. And then finally, our third objective type is our research objectives. And they may or may not meet the core data requirements, but they do not have an evidence base yet. But we know that they are significant opportunities for progress in the area, and they have limited research. I think you can think of research objectives as sort of being our priority areas for future research or emerging issues. With these objectives, in addition to the core, we really hope to provide a more holistic view of the important issues facing our nation. We will also be developing our leading health indicators for 2030, which will be based on our set of core objectives. Right now, we're in the process of receiving an initial set of recommendations from the National Academies of Science, Engineering, and Medicine, and we will be releasing our 2030 leading health indicators, so that smaller subset, after we launch Healthy People 2030. On this slide, I wanted to give a sense of what our objectives will be, what we've proposed our objectives will be for Healthy People 2030. And you can see here, and sorry that a research objective got cut off, but what you'll see is that we really have kept a majority of the objectives that we had in Healthy People 2030. So you'll see we have social determinants of health objectives related to poverty, children who have experienced a parent in jail. We also are explicitly calling out increasing employment, and our research objective is increasing the proportion of federal data sources that collect country of birth as a variable. I wanted to give you a quick glance at our objectives specific to mental health and mental disorders. So you'll see here a number of these are the same in 2020, but we've really collapsed it down to make those that are most important. So looking at and where we can really drive big public health policy change. Suicide rates, we are looking at major depressive disorders, serious mental illness, those who have a primary care physician in which they are screened for depression, And if you'll go to the next slide, you'll see our objectives for developmental and research. So a developmental objective with the number of youth who have serious emotional disturbance who have been identified and received appropriate treatment. And we also have a research objective that is looking to increase the proportion of adults who are homeless with mental health problems who are receiving those critical mental health services. So I just wanted to quickly talk about our target setting methods, and this is really important. What distinguishes Healthy People from other initiatives like the America Health Ranking or County Health Rankings is that every measurable Healthy People objective has a goal or a target that has been set. The targets were identified at the beginning of this year that we hope where the nation will be by the end of the decade. We like to think of our targets as being aspirational but achievable. And they were really set by our interagency work group and topic area, who are the subject matter and policy experts. So they are really sort of integrating the role of the subject matter, the policy, and the political consideration. So they're not just strictly a statistical construct. So we're not just saying a 10% increase over the decade like we did in 2020. We're really taking into account a wide swath of information to develop these targets. So quickly, our target setting methods, we will be hopefully releasing those early in the beginning of the decade so that folks can really replicate our targets at the state and local level. Our main methods will include maintaining consistency with national programs and regulations. We also have the ability to maintain baseline. So for those objectives where we didn't see an increase in the last decade or we're actually backsliding, sometimes it's important just to stay where we are so we don't get worse, and that's the target. We, of course, have been taking into consideration really doing projections, so using trend analysis to project out, looking at the role of minimal statistical significance, and then the other two here, having an increased percentage improvement based on trends as well. So we're really excited, and we will be releasing our target setting documentation and justification after the launch so that it can be replicated. So based on our different surveys, and we did conduct recent listening sessions over the last 2 years with our stakeholders to really make sure, what does Healthy People look like? What do we need to see? And we are going to show some of that through our website. When we launch, we will have our new website will really be organized in these cross-cutting topics that you can see here on the slide. We want to make sure that Healthy people can quickly find objectives related to their work, that they can see the data sources that are related to objectives to help inform program planning and measurement process and process improvement. And we really understand that the new website can help do that. So users can quickly navigate through the relevant topics, these cross-cutting topics. We've identified health conditions, social determinants of health, settings and systems, health behaviors, and populations. And what you can see when you go onto the new website is that all of the objectives, so not just the 5 or 6 of social determinants of health objectives I showed you earlier, but you can see other objectives in the SDOH domains that fit in. And it really allows for a better understanding of the cross-cutting nature of Healthy People and of public health in general. So at launch, our website will have the following content available. We'll have a crosswalk between Healthy People 2020 and 2030. So this allows you to see, hey, I was tracking an objective in 2020 and I want to know, did it make it? Did it make the cut? Where is it? Is there another objective that's related to that objective that I can continue tracking in 2030? We will be archiving our 2020 website so folks can go back. And of course, you'll see our developmental and research and core objectives. The core objectives are those with data, so they will have their own, every objective will have its own landing page with baseline statements, their totals, their targets, and the target setting method. We'll also be sure to share data sources and a quick overview of that specific objective. And then, of course, we'll have a bunch of resources. So we'll continue to have our evidence-based resources, our social determinants of health information, the 2030 framework, which I showed you, and also a toolkit for how to use 2030 in your work. As we go through the initiative over the next couple of years post-launch, we'll be releasing with these content that you see here. We will release our leading health indicators, our foundation health measures, which really look at the disability, life expectancy, et cetera. We will further flesh out our data by having population and demographic data. We will also include state data and trending data, and of course an opportunity for folks to look at case studies and stories from the field for folks who have been using the initiative, who've really been implementing, so that you can use that in your work. And of course the usual webinars and infographics. So we really want to make sure that Healthy People 2030 is a framework for engaging multiple sectors. So I just highlighted few here that I thought the folks on this call might fit into, but we, as I mentioned earlier, and as Sunny was discussing in Social Determinants of Health, we know that multiple stakeholders and multiple sectors are really involved in driving and contributing to health, and can help folks change their behavior. So here, and what we will do with our variety of resources is to really identify the role of multiple sectors in driving health. This was influenced by our stakeholder engagement subcommittee of the advisory committee, who'd really pushed us to engage other sectors in this work. And so you can see those here, and that can be really helpful for you as you're thinking about who do you refer out to, who needs to be in the room when you're developing those referral plans and identifying resources in the community. This is a guide for where you might need to go to sort of look for those individuals. We also have thought about so yes, we've identified these stakeholders and sectors, but how do you really engage them in developing public health partnerships? So we thought we could really help with that by identifying these key questions. So what are your shared values? How does the sector influence health? How could healthier people really benefit that sector? What does a successful partnership look like? And how can we as public health better facilitate interaction and partnership? And then just generally what metrics could be used? And so being able to answer those questions when you're trying to engage a diverse sector can really help solidify that partnership and make it easier for folks who really don't understand the health lingo, who aren't in that space, but who obviously impact it. This is a really great tool. So we will be providing these sort of sector information sheets. So how can you be a Healthy People 2030 champion? Of course, you can support the launch. You can share with us your public health challenges and resources. You can become data partners, and you can really share your bright spots. So we'd love to learn about the work that you guys are doing in Indiana and feature that and highlight it on our website. Thanks so much, and excited to be here today.
Really appreciate everyone's time today. Thank you so much, Ayanna, for participating and giving us an update, a preview, if you will. We're going to go ahead and conclude our webinar number 2, Healthy People 2020, on social determinants of health.